саламатсыздар ма? Мен Кеңес одағының батыры Мәншүк Мәметова атындағы Ақтөбе жоғары медициналық колледжінің шет тілі пәнінің оқытушысы Таласбаева Гүлмира Бақытжанқызы.
Okay, we're going to talk about respiratory disorders that are involving the lower respiratory structures. First, we're going to talk about infectious inflammatory diseases, and those are going to be found in chapter 21 of your book. First one we'll talk about is acute bronchitis. Now, this is something you're probably all pretty familiar with. The definition of acute bronchitis, and it's important to know these definitions because there's several different types of bronchitis, and if you can differentiate between chronic, acute, and others as we get along, the better you'll be. So the definition of acute is inflammation of the mucous membranes that line the bronchi and their branches. So if it involves the trachea, we're then looking at tracheobronchitis. If it just involves the bronchi and their branches, it's just acute bronchitis. Usually it begins as some other form of an upper respiratory infection, but it eventually extends all the way down the respiratory tract and infects all throughout the lungs as well. The secretory cells that produce mucus basically become super inflamed and just overproduce so much mucus, and so that's what starts irritating and causes that chronic cough then during acute bronchitis. The viral infections usually progress into the bronchitis. To diagnose it, we want to get a sputum culture, and our whole goal here is to rule out bacterial pneumonia, because bacterial pneumonia is more deadly and it's a lot harder to treat and to get over than just a viral acute infection with bronchitis. It can be very self-limiting, which means it lasts several days, but then it eventually kind of heals itself. You get over it after a little while, so that's typically why a doctor won't prescribe anything to try to treat it or whatever. So it's not bad. It's annoying, of course, because you're going to be coughing and uncomfortable, but typically we just encourage rest, a lot of fluids, and just tell the patient to be just patient with their recovery. So the signs and symptoms that you're going to see with acute bronchitis, they're going to have a fever and maybe some chills depending on how bad the infection gets. They definitely will feel some malaise and a headache just because of all of that excess mucus production and just the discomfort that they have with the infection. Initially, you're going to notice a dry, irritating, non-productive cough, and it's just that dry cough that, it's something that you hear most typically with patients who are not really producing a lot of that sputum or whatever, but it's really, really dry. Later on, the cough might become mucopurulent, which means you'll see them coughing up stuff, and a lot of times that sputum might be blood-streaked, especially if their airway has become very irritated from the excessive coughing. They can also have paroxysmal, which means recurrent or aggressive attacks of coughing that occur for quite a long period of time. Even once we control the cough and everything, every now and then it just keeps coming back more and more aggressive, and that cough is really aggravating. You might also notice some wheezing and maybe even some moist inspiratory crackles. Whenever you're listening to their lungs, it might just sound, you might be able to hear the sounds of that mucus production within the lungs from the infection. As a side effect of all of this coughing and the excess production of mucus and everything, you might also start noticing laryngitis, which, if you remember from the upper respiratory infections, it's just the loss of the voice and irritation and inflammation of the larynx. And then the sinusitis type complications occur because of that excess mucus that gets lodged in your sinuses, and they just feel like they just can never clear it out until the infection goes away. Best way to treat it is just put them on bed rest. You probably want to give them some fever medication like Tylenol or aspirin, and probably some cough medicine as well, just to help knock back the cough as much as we can. Now, we might not be able to totally control the cough, but if we can give them some just periods of rest from the excessive coughing, then they'll be very, very grateful. Okay, so some antitussives will help. We also want to increase their fluids. The whole purpose of increasing fluids is because fluids thin secretions, and if we thin those secretions, they're less likely of causing irritation, and they're also less likely of lodging in their sinuses, and it just creates more of a comfortable environment in their respiratory tract. Humidification is another way of producing fluids into the patient's system, because that's humidifying the air by putting water molecules in the air. As they breathe that in, it really does soothe the airway and makes it easier for them to breathe, and hopefully reduces their cough also. Dry air really aggravates a cough, and so once we humidify it, it really soothes their respiratory tract. We also want to see if a bacterial infection is the cause of the acute bronchitis, we want to give them some broad spectrum antibiotics, especially if we start noticing any secondary infections developing, either in their lungs or their sinuses or their throat, anywhere. Okay, if we start noticing some secondary infections just because their immune system is already being attacked, then we can give them some broad spectrum antibiotics to hopefully prevent those from getting really bad. On an x-ray, you're going to be able to see the white patches where the bronchitis is affecting the patient, and here you can see that. As a nurse, we want to encourage the patient to deep breathe and forcefully cough every 2 hours, because if we forcefully cough, hopefully we're clearing the secretions that can aggravate their respiratory tract and cause them to cough even more. We want to encourage them to spit whatever they're able to cough up instead of swallowing it. If they swallow it, it goes into their GI tract and it can cause other problems there. But if they spit it out, first of all, we can get a sample of that, and second of all, it's ridding their body of that mucus. And we want to help prevent the spread of an infection by teaching them good hand washing techniques and covering their mouth when coughing and everything also. Here's a question. We like the questions. Pause it, see if you can answer it, and then I'll show the answers. Okay, here's the answer for that one. Okay, look at the second one. Here's the answer. All right, check yourself, and I'll be back in just a little while to talk about something else.
Hi everyone! Today we're going to talk about nouns. A noun is a special kind of word called a part of speech. Nouns are words that name a person, place, thing, or idea. Here are some examples of nouns. Girl and boy are words that name people. Doctor, fireman, and artist are nouns too. This artist is a penguin. Penguin is also a noun. Nouns can also name places. Playground and park are nouns that name places. Words like country and state name places too. There are many, many words to name the things that are around us. Anything you can touch, see, hold, or feel is a noun, a type of noun called a concrete noun. Finally, there are nouns for ideas. These are a little trickier to understand as we can't see or touch them, but even though we can't touch them, we still need names for things like love, honesty, and happiness. These are called abstract nouns. Nouns can be singular, like if there is only one dog, or they can be plural, if there are several dogs. The last thing we are going to talk about today is the difference between common nouns and proper nouns. Common nouns are nouns that are general, or could belong to more than one item. Baby is a common noun. This is a baby, and this is a baby, but these babies have proper names. If I say that this baby is named Ethan, and this baby is named Emma, those are the proper nouns that name each specific baby. Proper nouns are special. We show that they are special by always using capital letters for proper nouns. Let's look at some more examples of common and proper nouns. I hope this helped you to understand what a noun is and learn the difference between a few of the types of nouns.